Welcome, everybody. My name is Lisette Fowler, and I'd like to welcome you to the informational webinar for the Robert Wood Johnson Foundation's Systems and Services Research for a Culture of Health Call for Proposals for 2018. We appreciate you joining us today. Before we begin, just a few housekeeping notes. This session is being recorded. Both the slides and a link to the recording will be sent to all attendees. So if you've registered and you're here, then you will be receiving a copy of the slides and the recording of the webinar. In addition to that, this presentation will be uploaded to our Systems for Action website under Funding Opportunities. As attendees, you will remain on mute during the entire call. You can, however, submit your questions using the chat box on the bottom left-hand corner of the screen. So if you hover over the bottom left-hand area, you'll see the little sign on the left. And if you click on that, it opens a chat box, and you can enter your question in that box. Please go ahead and enter your questions as they come up during the presentation, and we will address these near the end. For today, we're going to talk about the Systems for Action program and building a culture of health. We're going to discuss the specifics of our 2018 call for proposals. We'll show you how to apply, and then we'll have time for question and answer. So this is our leadership, Systems for Action leadership team. In the National Program Office, which is in the house at the University of Kentucky, we have Dr. Glenn Mays, who is our program director. Dr. Anna Hoover is our co-director, and I am Lisette Fowler, your deputy director. At the Robert Wood Johnson Foundation, we have two program officers, Carolyn Miller and Octavia Wojcik. And Octavia is going to provide a brief welcome. Octavia, I'll turn it to you.
Thank you very much, Lisette. So thank you to everybody for joining us today for the webinar. We're really excited by the interest that you have all shown in this call for proposals. This is the third call for proposals that has been released by the Systems for Action and program, and Glenn and his team will go through the details of what you need to know in order to apply. We really hope that this call for proposals and today's webinar is going to inspire organizations and individuals who haven't previously worked with the Robert Wood Johnson Foundation or the Systems for Action program to apply. So now I'll turn it back over to Glenn and team.
Fantastic. Thank you so much, Octavia. This is Glenn Mays. As Lizette mentioned, I am Director of the National Coordinating Center for the Systems for Action Research Program. I'm a professor here at the University of Kentucky, professor of Health Services and Systems Research. And I will be describing for you a little bit more about this research program and about what we're looking for in the 2018 call for proposals. First, this slide shows you some key materials that you will want to download and review as you're looking at this opportunity and considering the research ideas that you'd like to propose under this opportunity. First of all, there is a call for proposals document that describes in more detail the rationale for the kind of research that is sponsored through the Systems for Action program. It describes some priority areas of interest for this program in 2018 in the current year, as well as it provides details on the kinds of information you want to communicate in your proposal and how to submit the proposal. So you definitely want to download a copy of this call for proposals document. It's an 11-page PDF document that you want to access. That call for proposals document is housed on a landing page on the Robert Wood Johnson Foundation website that provides a summary of the funding opportunity, and so that funding opportunity summary webpage is the second item listed on this key materials slide. And again, you want to be familiar with the other resources that are available on that summary. There's an example proposal to give you a sense of what a proposal that is submitted to the foundation looks like, its key ingredients. There's a frequently asked questions document that describes some of the common questions that we receive about the Systems for Action research program and other resources. So please make sure to visit that funding opportunity summary page on the Foundation's website. Third, I want to call your attention to the Systems for Action research agenda. This was a research agenda that was developed a couple of years ago now when this program, the Systems for Action program, was first launched, developed by a technical advisory panel and experts from around the country, as well as colleagues at the Robert Wood Johnson Foundation, that describe some of the major areas of interest, the types of knowledge that we're trying to produce through the Systems for Action program. So you want to become familiar with that research agenda as well. And the fourth item on this slide is the description of currently funded studies that have been funded through the program through our prior calls. That information is on the Systems for Action website, which is the last URL link that you'll see there. So we encourage you to, as you're reviewing this opportunity, thinking about your ideas, please reference these 4 key materials as part of your preparations. Systems for Action is one of the Robert Wood Johnson Foundation's signature research programs that were launched to help build evidence relevant to the Culture of Health Action Framework. And so this program is designed to support knowledge and the production and application knowledge about how to actualize the Culture of Health Action Framework through its 4 action areas and the drivers that are associated with that with this framework. So it's an important touchstone for the program. Specifically, Systems for Action is designed to help us learn how to better align the delivery and financing systems that support health and well-being for populations across the country. In particular, there are 3 major sectors that we're interested in learning about how to align systems across those sectors. There's the medical care system that supports medical care services. There's the public health system that supports delivery of prevention and public health strategies targeted at populations. And there's the larger constellation of social and community services and systems that support a constellation of other services that address social needs, from housing and transportation, education, income support, child and family services, a whole host of other sectors and actors that operate in the social system. So we're looking to support research that produces new knowledge about how to better align and coordinate the activities across those 3 broad sectors: medical care, public health, social and community services, with a special attention paid to looking at ways of aligning those systems that can help us reduce inequities in health and well-being and promote improvements in health and well-being across the population. Again, you can visit the Systems for Action website at systemsforaction.org to look at the research agenda and also to review the studies that have been funded through the 3 previous calls for research proposals that the Foundation has supported to date through this program. And again, more about the rationale. We know that what drives health and well-being across populations certainly includes healthcare delivery, it includes public health programming, but it extends far beyond the health sector. Social circumstances, economic factors, and environmental exposures have large effects on health and well-being across the population, and large effects on health inequities and disparities across the population. And so with Systems for Action, we're paying attention to not just the health sector and the public health sector, but also the sectors that support strategies to address social, economic, and environmental determinants of health and well-being across the country. The reason for this research program and why we need new knowledge is that we know that our sectors that operate in health and in healthcare and in social and community services are not well aligned and coordinated. There's fragmentation within and across these systems. There are differences in resources, and there are constraints in the reach and the access to health, public health, medical care, and social services. And so we're looking for this research program, we're trying to test innovative ways of better aligning the delivery and financing systems that operate in these 3 sectors to promote coordination to promote greater efficiency and resource use, and importantly to reduce inequities and promote improvements in population health and well-being. And to do that, we know that the research testing system alignment mechanisms are going to need to look specifically at ways of coordinating activities and actions across these three broad sectors of medical care, public health, and social services. So these are collective action problems that we're looking for research to help us discover and test ways of overcoming these collective action problems. These problems could have to do with incentives that are not well aligned across medicine and public health and social services. These problems could relate to how costs and benefits are distributed inequitably across these sectors. They could relate to time lags in terms of how long it takes to see improvements when we implement innovations across these systems. Professional uncertainties about how to better align the services and supports that operate in these sectors, fragmented funding streams and financing mechanisms, and problems in the institutions and the infrastructure that support the delivery of medicine, public health, and social services. These are some of the areas that the challenges for system alignment that we're looking to new research to test some possible solutions. This is very definitely a multi-sector research program. Again, we're looking for studies that can help us learn about new ways of aligning activities and systems across these sectors. The kinds of sectors that are implicated in this research are listed on this slide. I've mentioned them already. The public health and the medical care sectors are two critical components. But then we also are focused on how to align those health-related sectors with social and community systems and services broadly defined. And we in this program we do use a broad definition of what programs and activities and institutions constitute that social and community sector and systems, including education, housing, transportation, criminal justice, services for children and families, community development, financing. We use a broad definition of the relevant social systems and community services that are relevant for studying alignment with medical care and public health systems. A little bit about the program structure. As I mentioned, this program was launched by the Foundation about 3 years ago now, in the fall of 2015. We've had several cycles of funding and call for proposals, and now have a constellation of research projects that are currently operating through this program. At the center, as was mentioned, we have a coordinating center that is based at the University of Kentucky that works with the Foundation and with a National Advisory Committee for this program to develop funding priorities and to coordinate the research across the different grantees that are testing mechanisms for system alignment in through their research projects. In addition to the Coordinating Center, we have 3 collaborating research centers that are based, one based in Chicago that involves the University of Chicago and its community partners, a second one based in Indiana that involves the University of Indianapolis, Purdue University, Indianapolis, as well as its community partners, and a third collaborating research center based in Arizona that involves Arizona State University and its collaborators. And those collaborating research centers work with our group at Kentucky both to conduct research, but also to synthesize research findings across multiple projects multiple research projects that are sponsored through this program. We also that third loop in this diagram shows you the individual research projects. We have a larger constellation of individual studies that have been funded through prior rounds of call for proposals that are again implementing specific research projects that are testing specific innovative mechanisms for aligning systems across medical care, public health, and social services. And you can see they're located in institutions and in communities across the country. And so this 2018 call for proposals is designed to select additional research projects to join this program and to continue to build knowledge about how to align systems and services. Again, a little bit more specifically about the 2018 call for proposals. This is a research program, so we're looking to fund sound and rigorous research that can produce reliable and generalizable knowledge about mechanisms that work for aligning systems across medical care, public health, and social services. So we're looking for, in this next round of proposals, we're looking for research proposals that will test solutions for aligning systems across those three broad sectors. We're obviously looking for the use of scientific methods, of rigorous scientific methods in studying the implementation of system alignment strategies and in evaluating their effectiveness. So strong methods for measurement and research design and analysis. And third, this is a 4-action research program. It's systems 4 action, and that second and third word of the program are very, very important. We're not producing knowledge for knowledge's sake. We're producing knowledge that can be acted upon. And we're looking for research proposals that will engage stakeholders, potential users of this knowledge, directly in the design and conduct of the research. So stakeholders from those systems that we're trying to better align, medical, social, and public health systems. Again, proposals that are submitted under this 2018 call, again, you should be proposing to test a novel or innovative mechanism for aligning or connecting delivery and financing systems across the medical, social, and public health sectors. So we want new knowledge, we want innovative new approaches for aligning systems. Your proposal should also address one or more of the priority areas that are described in the Systems for Action research agenda that I mentioned at the top of the call. So make sure to take a look at that agenda and think about how your idea might fit with one or more of those priorities. Third, and I know I said this several times, but I'll reiterate it again, we're looking for research studies that focus on alignment mechanisms that engage all 3 of those broad sectors: medical care, public health, and social and community services, broadly defined. Studies that can test alignment mechanisms that are cut across all 3 of those sectors. And fourth and finally, all the research that we support through this program really should, by addressing system alignment issues, should use an explicit equity lens for evaluating the implementation and the effectiveness of alignment mechanisms. If we're successful with aligning systems, we should see progress in reducing health inequities for the population groups that are served by these systems. You'll see in the call for proposals there are some more specific guidelines around how to develop your research questions. And in general, we think about four main ingredients you want to articulate in your proposal. You want to be clear about what specific delivery systems or financing systems your project is seeking to better align. The sectors, the types of programs that you're seeking to align through this work that fall within those 3 broad areas of medical care, public health, and social services. Secondly, you want to focus on and test a specific mechanism for aligning those systems. The mechanism may be organizational in nature. It may be some type of innovative alliance or partnership that you're testing. It may involve sharing information across those 3 types of systems to better coordinate work. It may involve innovative governance or decision-making models. It may involve innovative staffing models or use of staff or volunteers or others. But you want to be clear what's the mechanism of action that you're testing. How are you seeking to align these 3 broad types of systems through your work? Third, you want to be clear about the community setting and the population groups that are relevant to your proposed research. What populations are you targeting to try to benefit through the system alignment strategy that you're pursuing? And then fourth and finally, you want to be clear about the methodological approaches you're using. And again, this is multi-sector research. We expect this kind of research will require multidisciplinary approaches in research from a research design perspective, innovations in measurement and data sources, and innovations in analysis. And so, but those are the 4 main ingredients you want to think about bringing together in your proposal. Also want to mention that the Foundation has identified 4 thematic focus areas that really guide the work that the Foundation is supporting under the Culture of Health Action Framework. And it's important to recognize these thematic focus areas and understand how the research you propose is likely to connect and inform one or more of these broad focus areas. The first focus area, as mentioned here, is transforming health and healthcare systems. We would expect any proposal that's relevant to Systems for Action should be relevant to this particular focus area, the transforming health and healthcare systems focus area, because of the very tight alignment between our Systems for Action research program and this area. There are 2 other focus areas the Foundation has identified that may also be relevant to the research you propose. One focused on healthy children, healthy weight, and another focused on healthy communities. And so we encourage you just to be aware of these focus areas and to think about how your research may contribute to knowledge in one or more of these areas. And the website on a link to the Foundation's page describing these focus areas in more detail is given at the bottom of this slide. Also want to mention that for 2018, for this particular call for proposals under the Systems for Action program, we have identified some topics of special interest that we're particularly interested in seeing some interesting ideas put forward in proposals. So we invite you to take a look at these topics of special interest and think about whether your idea aligns with one or more of these topics. You don't have to. Your proposal doesn't have to address one of these topics, but these are areas that we're particularly interested in seeing some innovative research being conducted, because these are areas where we have considerable gaps in knowledge now in terms of looking at the existing evidence base in these areas. These are described in more detail in the call for proposals document. And I'll just mention them briefly. One, we're interested in system alignment mechanisms that are developed and led by stakeholders outside the formal public health and medical sectors. So we're interested in seeing innovative alignment mechanisms that are being developed from stakeholders in the social and community service sectors in particular. So are there ideas from outside the health arena that we can bring in now and test for aligning these sectors? Secondly, we're interested in particular in system alignment mechanisms that are designed to change the behavior of systems, delivery and financing systems, not just changing the behavior of individual patients or community members or individual families. So we really want to see system alignment mechanisms that operate at the system level and that can have community-wide or population-wide impact through this work. Third, we're especially interested in ideas that may involve financing and payment mechanisms that can better align medical, social, and public health services, including any ideas for how you incentivize and finance cross-sector collaboration across medical, social, and public health services. This is an area where we don't have a lot of research happening currently in this space. We'd like to see more. And then fourthly, we're always interested in proposals that can find innovative ways of using system science research methodologies in their work, including methods for network analysis or agent-based modeling or system dynamics modeling, as well as microsimulation. These are some specific research methodologies that are especially well suited to studying systems, delivery and financing systems. And so we feel like they could have, particular. They could be value added in terms of the types of research that we're looking to pursue through this program. As I mentioned earlier, this is multi-sector research, and we expect research teams will need to have multidisciplinary expertise represented on them, including team members who've got strong research skills, strong knowledge in terms of theoretical and methodological expertise, but also people on your team who've got on-the-ground operational knowledge about the systems and the programs and the communities that are relevant for these systems. And again, we're looking for research teams as you think about who's going to be a part of your research team. You want to have representative on that team expertise in each of the three broad types of systems that we're focused, that our program focuses on: medical care, public health, and social and community services, broadly defined. As I mentioned earlier, a few other considerations. Stakeholder engagement is very, very important for this kind of research. We're looking for studies that can produce knowledge that can be rapidly acted upon. And so you want to think at the beginning, who's going to use this knowledge that we're producing? What stakeholders are positioned to take action based on this knowledge? And those stakeholders should be involved in the research project. And as well as the communities that stand to gain from the system alignment mechanisms that are being tested here. There's a variety of ways of involving stakeholders in research, and so we invite you to think creatively and to think innovatively about how you can best engage stakeholders in the research through a variety of networking and collaborative and participatory research approaches. We certainly we are interested, again, as Octavia mentioned, in receiving applications from organizations and individuals who are new to the foundation and certainly new to the Systems for Action research program. And so we invite applications from a wide variety of organizations, not just academic and research organizations, but we invite applications from community organizations and government and in practice-based agencies as well. But we also remind you this is a research program, so you want to make sure that you do have people with appropriate research expertise who are also a part of your team. It's really an important balance between having the innovative ideas and knowledge about how to implement strategies in communities, and making sure you've got the requisite research expertise to rigorously test those innovations in real-world communities. A few more points about the award details, and again, these are all detailed in the call for proposals document. We're seeking proposals for projects that can be up to 24 months in duration, so up to 2 years in projects, and projects with up to $25,000 in total funding is available for each project. And the Foundation expects to fund up to 6 awards through this 2018 call for proposals. And again, you want to make sure that you're proposing a novel system alignment mechanism. This is a relatively short period, and there are both time constraints and resource constraints that are available that you'll need to give careful consideration to, and therefore think about what projects are possible and feasible given the time and given the resources that are available through this call. We expect that some of the projects and the studies that are proposed here will want to take advantage of existing innovations that are currently being implemented in practice that can be studied expeditiously. You may want to think about how you can take advantage of existing data sources. As well as innovative uses of mixed method approaches for studying innovations in system alignment. Okay, just a quick note on eligibility. And again, this is also detailed in the call for proposals document. This call is open to public governmental entities or nonprofit organizations that are tax exempt under the 501c IRS code. Applicants must be based in the United States or its territories. The Foundation makes awards to organizations, not to individuals, so that's important to keep note of. And we recognize that multi-organizational consortia, partnerships, and collaborations are likely to be productive ways of implementing this kind of research. We encourage those kind of multi-sectoral, multi-organizational consortia arrangements to conduct the research. But if you're using a consortium approach, you do need to identify a single eligible organization who will be designated as the primary applicant for the award. Okay, so I'm going to turn it back over to Lizeth to talk a little bit about the application process details.
Thank you so much, Glenn. And just as a side note, the questions are really coming in, so please keep submitting your questions. So a little bit about the application process. So we have, you will have to submit a one-letter page of intent to the systemsforaction@uky.edu email by September 12th. This is a very brief, again, just a one-page letter of intent that includes the title, a brief description of your proposed research, a listing of the participating investigators and institutions. Again, this LOI is not binding and it's not required. So while we highly encourage you to do it, it's not required to actually apply for this program. However, we highly encourage you to submit an LOI because it will be extremely useful for us in helping us find content reviewers that have the content expertise for the work that you are proposing. So we highly encourage you to submit a one-page LOI by September 12th. Now, in order to apply for the proposal, everything goes through the Foundation's online system. And the instructions for that, again, are found either through the link on our website or through the actual RWJF CFP. The application will be a 10-page proposal that will be due by 3 p.m. on October 10th, 2018. After we receive those proposals, we'll go through a rigorous review process, again by subject matter experts, and you will be notified of funding decisions in early January. We use the following selection criteria to review the proposals. And if you look at the actual CFP, you'll find a lot more information about what we specifically mean by each of these criteria. But please keep this in mind as you prepare your proposal, that we're looking at significance, innovation, multidisciplinary expertise, the strength of the environment, the scientific merit and feasibility of the research approach that you propose, and the capacity for supporting meaningful system alignment and system change strategies. Again, as Dr. Mays mentioned, this is a 4-action program, so that last part is very important. Again, please refer to the CFP for additional details on the selection criteria. This slide just shows a couple of important dates. The first date is September 12th, and that is the deadline for the receipt of the one-page letter of intent to systemsforaction@uky.edu. The next important deadline is October 10th at 3 p.m., and this is the official deadline for receipt of your full proposals. All proposals have to be submitted via the RWJF online system. Please, we encourage you to log on as soon as possible and become really familiar with it's very simple, but we want you to be familiar with this process. We will not be accepting late submissions, so it's very important that you look through this. We will again notify finalists of funding recommendations in January, sometime in January, and we anticipate that the grants will start March 1st of 2019. To help you, I just have a few slides here on what the RWJF's application and review, that's what they call A&R, the application and review system. When you log in, you'll see a screen like this, and one of the very first things that you want to do is invite contributors, and I'll go into why that's important at the end. Well, first of all, these are multi-collaborative proposals, so it's important that other people have access to the preparation of your proposal. So you click on that box that says invite contributors, and then you get something like this, and you can enter that person's email, and they will receive an invitation so that they can participate in the proposal process. This is sort of what your home screen will look like. You see that there are various sections, and each of the separate sections has, when you click on that, it has specific information on what you need to do to complete that section, starting from eligibility criteria to contacts to the final polls and surveys. As you don't have to work on these sequentially. You can work on them in any order, and as you start one of these sections, the little status circle will be half highlighted. Once you finish a section, that status circle will be completely colored in. And only after you have completed all of the sections will you be able to hit the submit button, which again will only be live once you completed all of those sections. So these are the top 8 reasons why you could possibly miss a deadline. So the most important thing is when you are having trouble with the online application system and you could possibly miss a deadline, we encourage you to prepare early so this doesn't happen. But if something is happening at the last minute, we urge you to please email us again at systemsforaction@uky.edu and include any documents that you've been working on that if you've had trouble uploading them or if there's a problem going on, include all of those in the email. And again, that needs to be submitted as soon as possible if you're having problems. In order to avoid these problems, we encourage you to complete your application online instead of doing it all offline and trying to upload it all at the last minute. So as soon as you log in, you'll see that there are templates for everything. There's a template for the proposal narrative. There's a template for the budget narrative. And so download those templates, and as soon as you finish working on them, upload them online as soon as possible. Again, if you please look at the system well in advance of the deadline, this really helps with preventing any late problems or any technical problems that you could possibly have. If you've started an application and for some reason can't get back in it, there are options to save your work as you go along. And if you cannot find that application or if you've been logged on to the system, please don't start another application. Just contact us here again at systemsforaction@uky.edu, and we will help you find that application that you've already started, and you can complete that application. Again, as soon as you've completed a section, there are various options of saving your work. You can hit save and continue working on it. You can hit save and move to another section. Or when you're finally finished with that section, you can hit save, section finished. However, you can still go back and make changes to that. Only when you've completed all of the sections, again, does that submit button become active and you can actually submit the final application. And believe it or not, this is something that happens all the time. You will complete all of the sections but not hit that final submit button. Please note that unless you hit that final submit button once it's live, your application is not officially submitted. Only when you hit that submit button does the application go in. And you will immediately receive an email saying you have submitted your application. If you believe that you've submitted the application but have not received an email indicating that, please go back in and make sure that you actually have hit that submit button. And if you have and still have not received an email, please contact us. Again, the deadline for this is October 10th, 2018 at 3 p.m. Eastern Time. So it has to be Eastern Time. Confusion is not an acceptable excuse for missing the deadline. So please keep that burned in the back of your mind. And most importantly, I showed you at the beginning how you can invite contributors. There are many times where your system, your computer might crash at the last minute, so we always encourage you to have someone else eligible to submit that application. If something happens at the last minute to your computer, that person can actually hit submit. Okay? And I will end with that. I know we've got quite a few questions queued up. Again, if you are having trouble figuring out how to submit a question, you'll see the little icon on the bottom left-hand corner of your screen, and when you click on that, a little chat box opens and enter your question there. And so with that, I think we will turn it over to questions, and we have quite a few queued up. Glenn, I don't know if you can see the questions. If not, I can read them.
Yes, I can, and so there's a question about eligibility and organizational capacity, how we view startups in terms of funding eligibility. Is there requirements about an annual operating budget, et cetera? Again, if you meet the eligibility criteria in terms of being a public sector organization or a 501c not-for-profit status organization, you are eligible for applying for this program. For projects that are reviewed and selected for funding consideration by the foundation, at that stage, for newer organizations, there are typically additional verification that is done by the foundation to ensure the organization has the appropriate capacity for managing the grant in terms of financial and legal capabilities. But in terms of eligibility at the application stage, if you meet that, if your organization is a public entity or a 501c3 nonprofit, you are eligible. Next question, can we elaborate on what's meant by delivery system? A great question. We get that every year. Delivery systems, broadly defined, are the constellation of organizations and people and policies that are needed to deliver a specific service or program. And so when you think about a medical care, a healthcare delivery system, or a public health delivery system, or the delivery system for housing or transportation or education, you want to think about the constellation of organizations, people, and policies that allow implementation of those programs and services. So again, and we look to you in the project that you're proposing to kind of define that delivery system as it is relevant to the type of alignment you're looking to achieve. I'd
also like to note that we do have I see a lot of the questions that we do have answers for on our FAQ on our website. So if we don't get you to your question today, please look at that FAQ on our webpage, and if you still don't see your answer there, then email us if we did not provide an answer either today or on that site.
Great. Yeah, so moving along, question about whether we have geographic priorities. And the short answer is no, there's not a specific geographic area of the country that we're more or less interested in. We're obviously interested in testing a system alignment strategies and understanding how they might operate in a variety of community and geographic contexts. Another question, what potential role do we see for the Federal Reserve in this type of work from a prior slide? That's a great question. We think obviously financing systems are important. We talk about we're interested in this program in testing ways of aligning delivery systems or aligning financing systems for medical, social, and public health services. And the Federal Reserve is one important institution that is involved in supporting financing for a variety of health and community and social services, housing, transportation, and other structures. So we encourage you to think about how financing mechanisms and financing systems may play out in your idea of interest. Another question, are any of the projects completed and have results or outcomes to report that can inform the process going forward? That question is relevant to our currently funded projects. The short answer is yes. We do have projects that have been up and running for our earliest funded projects have finished their 2 years of project work. As there are results from our currently funded projects, we post those results in terms of publications and reports on the Systems for Action website. So you can go to the website and scroll down through our list of currently funded projects and look to see if there are publications and reports describing findings from those projects. We also do periodic webinars describing research in progress, emerging findings and knowledge from these projects, and those are conducted on a bi-monthly basis. We do about 2 a month, and so we encourage you to log in and participate in those webinars as well. Let's see. Do you need to have an existing community collaborative or existing relationships that already link across those 3 sectors? Good question. Not necessarily. We welcome you to propose something new, to try a new approach. that doesn't yet exist in nature. That's fair game for this opportunity. But again, you've got to remember there is limited time and limited resources. So propose something that you could implement and evaluate within a 2-year period with the funding available. A question about, does the project need to address both delivery and financing, and can address one or the other? Short answer there is it's fine to address one or the other. If you want to focus specifically on aligning financing systems, that's fine, or aligning delivery systems, that's fine as well. Can improving mental health services be a component of a project focus? Absolutely. Mental health is a very, very important element of our healthcare and public health delivery systems. So encourage you to think about how mental health fits into the system alignment strategies that you are proposing. Question about qualitative methods. Are they considered as rigorous? Absolutely. Absolutely. The full constellation of research methodologies are relevant here. We encourage you to think about rigorous qualitative, rigorous quantitative, and rigorous mixed method approaches. Whatever tools in your toolbox are necessary to produce the knowledge that we're looking for in this program. And another question about defining rigorous scientific methods there. We're looking again just for methods that can produce generalizable knowledge about the implementation and impact of the system alignment strategies that you're proposing to study. So whichever methods are appropriate for giving us that knowledge that we can rely on about the alignment mechanisms that you are proposing for study. A question asking us to elaborate more on explicit equity lens. Well, one thing I'd point you to is, again, the call for proposals document, the CFP document, has a paragraph explicitly on the equity lens and on the definition that we and the colleagues at the Robert Johnson Foundation use for defining health equity. So we point you to that. There's also a reference to that definition that references a larger report that was produced by the foundation that will elaborate on that, on that construct and how you might want to think about it in terms of your research ideas. Question asking, would formally evaluating a program that is currently in place and aligns with the focus areas, is that appropriate? And I would say absolutely. If there's something that's existing that's currently a system alignment mechanism that's innovative, that's currently being operated, currently being implemented, but we don't yet have evidence about whether or not it works, that's a great opportunity for thinking about how you can put a research design around that existing program, around that existing system alignment mechanism to produce knowledge that could inform others. So that's appropriate. Let's see. Question: our nonprofit is testing a way to practically align service delivery in a way that reaches into the 3 sectors described, but we are not itself a research institution. We train agencies that do direct services. So you're asking. So I would say that's potentially a relevant. That's potentially an arrangement that would be relevant for the Systems for Action program. Again, we're inviting applications from a variety of different organizations that have an idea, an innovative idea for aligning systems. You do not need to be a university-based organization or a research institution. You're welcome. Fundable proposals may be submitted from non-academic service organizations, training agencies, and others, government or nonprofit agencies. So you're welcome to propose projects for this program from those kind of settings. But again, remember, this is a research program, so if your organization doesn't house people with research expertise, you want to look to reach out and partner with some individuals from outside your organization that can bring the relevant research expertise to your project. Okay, scrolling right on down.
Let's piggyback off on that because there is another question. can a nonprofit agency or even a research institution partner with a for-profit to execute the research? And yes, as long as the nonprofit is the lead and submits the proposal, you can partner with a for-profit.
Great, thank you, Lizette. A question, will you fund proposals that address populations other than healthy children, healthy weight? Absolutely. The healthy children, healthy weight focus area is just one of the Foundation's focus areas, and it's not the only population of interest. So we are open to proposals and ideas that address other population groups and topics. Absolutely. Let's see. So I've mentioned a question saying that I've specifically talked about proposals should test a proposed mechanism for system alignment. Does that mean that the mechanism needs to be implemented, or can it be tested through some of the methodological approaches listed, such as system dynamics, agent-based simulation? The answer to that question is yes. We are open to testing mechanisms through both testing them in the real world as well as testing them through model-based approaches like some of the system science methodologies. So that is, either one of those approaches is fair game in terms of this program. Let's see here. I'm just scrolling down our list. A question about who are the stakeholders that we want to benefit from the new knowledge created through the research. Well, we're looking to you to identify that for us as part of your application. In general, if you're proposing to test a novel way of aligning systems and services across the medical, social, public health sectors, then the people who are likely to use that knowledge are going to be people most likely embedded within those different systems who would be in a position to implement the knowledge that you're producing through your research. But so we want you to think carefully about who are the knowledge users that are relevant to the research you're proposing. Identify them and then engage them in appropriate ways in your research. And so we have to rely on you to think through who's going to be in a position to act upon the knowledge we produce when we test this innovative way of aligning systems. Okay. A question about proposing a partnership with a specific research institution. So the question is, do you, the applicant, identify who the research institution is that you need to partner with, or would you use researchers who are already working with our RWJF program? And really it's the former. Collaborations involve intentional coming together of organizations, and so our Systems for Action program is not in a position at this stage to do kind of matchmaking between implementing organizations and research organizations. We encourage you to reach out to individuals and organizations that are in your orbit who may have an interest in collaboration. And that's one major reason why we have a relatively extended period between announcing this call for proposals and when the proposals are due. We recognize that it takes time to identify relevant organizations and individuals to partner with and to develop those ideas collaboratively. So, but that is something that we need you to do as an applicant organization. Think through who needs to be on your bus for making this project a reality, and reaching out to that. You're welcome to again take a look at our existing types of projects that have been funded and the kinds of collaborations that you see there for ideas. But that is an important element of these projects.
I just want to clarify the funding amount since I see a couple of questions on that. So the funding is up to $250,000 total. I think Glenn might have said $25,000. It's $250,000 total over the entire 2-year period. So it's not $250,000 per year. It's $250,000 total over a period of up to 24 months.
Great. Yeah, thank you. I apologize if I misspoke, but those are important parameters to keep in mind.
Also see some questions regarding the review criteria. Again, you can find full details on what we mean by the definition of some of that criteria on the actual CFP or on our website.
Question about our 3 coordinating centers. You do not need to be in any kind of geographic proximity either to the coordinating center based here at University of Kentucky or any of the 3 collaborating research centers in the program. We just want you to be aware these are all important centers. They're a part of the Systems for Action program, and these are centers that are available to collaborate and to share knowledge among grantees that are participating in the program. But there's no need to be located close to any of these centers or other grantees of the program. We do have a variety of mechanisms that we support that help grantees that are funded through this program, help them connect with and collaborate with other funded entities. So those are resources that all of our grantees are able to take advantage of. Question about, are there any priority initiatives or areas of interest to this program in terms of health issues like tobacco or other specific health issues? We have not identified any specific health issues that are priorities for this research program. Again, our program is focused on systems and how to align those systems. And so the specific health issues that are relevant and the specific population groups that are relevant here, that's really up to you to kind of articulate and to build into your projects. Let's see. Rolling down here.
There's some questions about the LOI and what's the incentive for submitting an LOI, whether we can provide feedback on the LOI. We could answer those questions.
Yeah, we can't provide feedback. The LOI is informational only. It helps us anticipate how many applications will be coming in, and importantly, it helps us identify what kind of expertise we need to have represented among our reviewers. So the incentive is, it's not required, but the incentive for you is you want to submit that LOI so that we make sure that we have reviewers on our review team who are able to understand and have expertise and can give your application the most thorough review possible. So that's why we ask for the LOI. It's informational only to help us put together a review process that's going to be as responsive as possible to your application. And we're not able to provide feedback to the letters of intent.
I also see some questions regarding the application process. So you can, the co-PI could submit can the co-PI submit the application, or must an authorized representative of the applicant organization submit the RWJF? Again, you can provide the level when you invite people to participate in the application process. You can provide the level that you want. So you can provide them with only contributing, or you can provide them with the access to actually submit the application. So if the PI is from, let's say, University X, and the co-PI is from another university, the co-PI could still hit the submit button, but all the information will be the applicant organization. So I hope that that's clear.
Great. Fantastic. And I see that we are at the top of the hour. If you submitted a question and we haven't been able to get to that, we will be archiving these questions and then updating our Q&A document with responses to these other questions. So we'll make that available. And also you can feel free to email the program again at systemsforaction@uky.edu with other questions you may have, and we're glad to entertain those. So thank you again for participating in this webinar. We hope that we'll be hearing from you as part of our call for proposals process. Please keep those key dates in mind, and feel free to reach out to our project team if you have other other questions or information needs. Thank you so much.